Hi, and welcome to this presentation on flexible work arrangements. I appreciate the time you're taking to review this presentation. The purpose of this presentation is really to introduce to you a plan that I propose to help alleviate the problem that the workforce is continuing to decline at a rapid rate. As the baby boomers retire, and the fact that the population growth is slower than it has been in the past, there really isn't the supply doesn't equal the demand anymore. In addition, the healthcare needs continue to increase because as the baby boomers age, they're requiring more healthcare, but also insurance has expanded to so many people due to the governmental programs such as the ACA, which really then does put a strain on healthcare organizations to maintain appropriate staffing levels and ultimately the best patient care possible. It is also predicted that by 2020, healthcare jobs will continue to grow in need, with registered nurses being the most significant. As you know, staffing shortages obviously have a negative impact on any organization. Financially, we could be suffering because of the increased expense for paying overtime. And also, what's probably the most important thing is the impact to our patients that we serve. We could have adverse outcomes, increased preventable errors, and things that obviously as an organization we do not want to be associated with. Not only are the baby boomers retiring, but what's interesting is in the workforce, Generation X and millennials make up the majority of the workforce for the first time in 2015. What's interesting about that, though, is although baby boomers are definitely the sandwich generation and they are caring for both the elderly and the children, a lot of Generation X and millennials live in a dual income household, which then increases the struggle to find balance between work and home responsibilities. Baby boomers, as mentioned earlier, the sandwich generation, also continue to find balance between work and home responsibilities, especially if a large majority of them are also trying to care for their grandchildren, not to mention the expenses of caring for all these individuals. Study has shown that these imbalances causes work-life conflict. Work-life conflict results in poor mental health, lower job satisfaction, increased turnover, less work productivity, which really does lead to decreased patient outcomes. What's the kicker of all this is reimbursement, as you know, is based on outcomes. So if we have lower outcomes, reimbursement models get changed, bundle payment programs obviously are initiated, and we could really see a lack of reimbursement, which again could affect our overall financial stability. So Human Resources really has a goal to come up with a plan that really aligns strategically to the missions, visions, and values of the organization. How we plan to do this is really to survey key stakeholders for employee input, really survey managers, the executive leadership, and figure out what is the desired need out there. How can we offset the fact that the supply doesn't equal the demand, and what can we do to ensure that we have appropriate staffing levels for our future, not just from today, but also for the future 5, 10, and 20 years down the road. We need to make sure that any plan that we come up with is to avoid patient care and compromise. We need to make sure that we offer innovative things such as flexible work arrangements, which I will go into more detail in the next slide, to really meet the needs of the employee, which also sends a message that they're valued, the organization cares. We also then, as Human Resources, need to make sure that we safeguard the organization's profitability while also achieving and understanding the desired outcomes, but ultimately, what are the patient needs that we are caring for, and ensuring that we have the appropriate plan in place to not compromise that, because patient care is our #1 priority. So any plan that we consider, especially in flexible work arrangements, we need to make sure that we are also, from a regulatory standpoint, meeting the staffing and the skill mix guidelines set forth. We need to make sure that we include in the plan consideration for the Equal Employment Opportunity Commission, because this plan must be fair to all to avoid any type of discrimination. We need to make sure that we follow the mandates of the Fair Labor Standards Act to make sure that we are not, having the employees work overtime or having them do anything that would be unfair. And the other one that I think is very, very important is we have to make sure that we uphold the Defense of Marriage Act. This plan really must be equally respected the fact that there are traditional and non-traditional marriages now out in the society, and anything that we offer to a traditional couple, we must make sure that is equally offered to a non-traditional marriage. And that's going to become very important. As you know, our society is changing. So we want to make sure that we stay current with those times. Prior to implementing a plan, Human Resources also must continue to perform a job analysis to determine what position organizationally would really benefit from flexible work arrangements. And can we also offset it with updating job descriptions so when people come into this organization, they understand that there could be a potential for flexible working arrangements and that it could be incorporated within the hours that they work, which make us more marketable and attractive to the new employee coming in the door. So What the recommendation is flexible working arrangements. Flexible working arrangements in the studies has shown that it leads to less work-life conflict, which then improves employee satisfaction, retention, participation, and overall productivity. It also in another study shows that it lowers the stress level of the employee, has less tardiness, and also less absenteeism. But probably the most important thing that flexible work arrangement does is it helps to lead to a healthy environment. A healthy environment is one that really looks at open communication, collaboration, making decision making at all levels, looking at staffing and making appropriate decisions about that, giving meaningful recognition, authentic leadership. The goal of flexible working arrangements is one, to not only meet the needs of our employees, to provide an environment where there is less work-life conflict that will ultimately then benefit the organization and the patients that we care for. If we have healthier environments, healthier employment, our patients will then receive the best care possible. When you are considering a flexible working arrangement, there's multiple things that you need to consider. The first would be to define what is a flexible working arrangement. In some studies, fewer hours worked than either their on a permanent basis or sporadic need was defined as a flexible working arrangement. So maybe for a period of 2 or 3 months, you only worked 36 hours versus 40 hours. Reducing your hours, non-standard hours, coming up with shifts like 3A to 3P instead of your 7A to 7P or your 7 to 3. Working remotely if there's an opportunity for work to be done off-site. And also what's known as a compressed schedule, which is also known as a compressed work week. Another example of flexible working arrangements was self-scheduling. Having a self-scheduling model where the employees can choose their days on and days off helps because then they have more input into how they will be working and can arrange it based on their personal needs. Compressed work weeks is really a set schedule that has a regular start and stop time and usually occurs over a few consecutive days in a row. I think the key thing to recognize is that there cannot be a standardized approach to this implementation. Each department will have to work with their HR representative to determine what is the best approach due to the nature of the department's specific requirements. We know that sometimes in healthcare, things are very task-oriented. So you need to make sure that whatever plan is being developed, that the plan still covers the needs of the patients and the tasks that need to be completed at any given time. We also need to make sure that we find the right balance as a leadership team as to what is too little or too much flexibility. We have to have guidelines around what we expect. How many hours a week? How many days can they work consecutively? If we allow too much flexibility, it will actually put pressure on the employee and have them feel like they have to make a decision about how much time they have to devote to work, which in turn can cause more work-life conflict because they might choose more work hours than what they really want to because they feel like they need to, or there might be implications if they don't. So the recommendation for this program is to really pilot in a specific area prior to rolling out organizationally. The reason for this is it allows you to develop a proof of concept. It allows you to really identify before and after employee satisfaction. Has flexible working arrangements made a difference? Can we show demonstrated improved outcomes? And can we really identify implications for future staffing needs? Recognizing that flexible working arrangements will be an operational change and there will be less bodies maybe to fill certain areas, it's important to have a proof of concept so you can start to identify what are going to be the future needs of the organization from a staffing perspective. It also allows for strategic planning to occur, so in 5 years, if the decision is to continue with flexible working arrangements, we now have the funding to do more work marketing, recruiting, etc. The other thing that we also need to make sure that we standardize across the board is that skill mix and staffing levels must be maintained at all time and per accreditation standards. And the other thing is studies have shown that if you work more than 3 consecutive days in a row, your likelihood to error increases, preventable errors, mortality rates can increase. So we really should probably put limits around how many consecutive days, no more than 3, and also throughout a work week, no one should exceed 40 hours a week because no one wants to be paying overtime if it's not necessary. From an operational, human capital, and community relationship impact, really, we need to understand the current state of the department and the organization's vacancy rate. Offering unique scheduling may reduce the number of bodies to fill a position during a period of time. This may then offset the need for the actual schedule, but we may now have to recruit for open positions as they arrive. So identifying a short-term budget and then also forecasting future budget needs is going to become important if this is going to work. Also, you will have to determine skill mix. What do you have to budget for as far as RN needs? Might be different than patient care assistants and or other ancillary services. It is highly recommended that we implement a quality improvement program, something like lean methodologies. This is going to be change. Change management requires a lot of communication, requires a lot of working together, and really requires a lot of support for the operational areas that are going to be inputting and creating this change. So we really want to have a strong change management program, and we really want to have a way that these individuals who are going to pilot this can capture real-time information about outcomes, about schedule, about satisfaction, and come up with an idea of whether or not this is working or not working. Having something like lean methodologies implemented allows for rapid cycles of change as a problem is noticed. We can do 5 whys, we can easily get to the root cause of the problem, and then we can hopefully, instead of automatically saying this program doesn't work, maybe make modifications to the pilot program so we can look for a long-term solution of implementing flexible work arrangements. Also, having something like lean methodologies or a quality improvement program, employees can have input into the solution. So it really kind of values the employee's input, but it also makes the organization really look important as valuable and understanding of the employee's needs and working with the employee to create this good environment, which again leads to a healthy work environment. If this is successful and if we are able to do this, we really need to highlight this to the community. We need to show the community that as an organization, we nurture our employees. We care for our employees. Caring for our employees will help to bring in more people to see our organization, but also helps with spread of word. We need to show the community that we can respond to the changing times and we can be sensitive to the non-traditional needs that are out there today. And we really need to show our community that we do support our employees, especially those who live in our community. We support their home needs and we want to help encourage their home needs. Obviously, implementing a program always has some potential costs. As mentioned earlier, unique scheduling may require some recruiting. So we are going to need some additional money probably put towards a recruiting plan, both short-term and long-term. But hopefully we can offset some of this by the fact that we will not be having to pay as much overtime. In addition, we probably will need additional funding to go towards the quality department and change management. We need to provide the funds and the resources to allow these floors, especially the pilot floor, to pilot, to really monitor outcomes. And this is hopefully going to help avoid the adverse outcomes that could potentially come if we continue to try our program without really looking at what is the expected and desired outcomes. Anytime you implement something new, you're always going to need education and training resources. And I really think that there should be a strategic plan for marketing for new scheduling options, because if this is successful, this would definitely be a strategic move to market for, which would bring in new people, bring in maybe other baby boomers who have left the workforce due to constraints with their schedule. And we can really highlight this as how we care. Desired outcomes and potential consequences. Desired outcomes, as they're listed there: improved employee satisfaction, patient satisfaction, less absenteeism, less tardiness, decreased mortality rate, decrease in patient preventable errors, improved patient outcomes, improved retention, and definitely more marketing when it comes to recruiting. As far as consequences, if we do not consider this and if we do not consider flexible working, we could see actually an increase in turnover as demands out there get increased for the employees. We could have a lack of supply, people won't be able to recruit. We'll have increased absenteeism as their personnel needs continue to increase, tardiness, lower employee satisfaction, decreased patient outcome. As a community, our reputation will suffer. We may be increased risk for adverse outcomes, which could include mortality rate, preventable errors, litigation, lawsuit. But most importantly, if we have any of that, we could also be at risk for lack of funding, bond rating, and anything else that could come from those type of situations. Really, the goal of any human resource management is to really increase organizational profitability, improve employee productivity, and improve employee satisfaction. Flexible working arrangements does this. It helps to decrease the conflict that an employee feels. Decreased conflict leads to improved productivity as well as improved staff satisfaction, which ultimately leads to greater success for the organization. Greater success for the organization is visualized by a healthy work environment, and healthy work environments promote communication, promote collaboration, which ultimately provides better patient care, decreases mortality rate, decreases complication, and decreases preventable errors to our patients. I hope that you will consider implementing flexible working arrangements and helping to recognize the fact that our employees' home lives are changing. They're not as traditional as what they are. We're getting into a unique situation where supply doesn't equal demand, and flexible working arrangements may actually help to offset that. Thank you very much for your time. Have a good day.